diathermy for an arterial wound. So the goal of the treatment is soft tissue healing, and diathermy is appropriate because the non-thermal treatment can increase white blood cell infiltration and phagocytosis, and it does that by increasing the circulation and tissue oxygenation. So contraindications, do you have a pacemaker?
Nope.
Do you have any metal? We're going to be doing her arm. That's where the arterial wound is. Do you have any metal around in your arm?
No, but jewelry.
Yep, so we need to take the jewelry off, yeah. So no metal in the arm. So you do want to make sure the patient removes any metal jewelry, or if they're wearing any clothes with zippers on them, that needs to come off as well. And then other precautions for just the treatment in general would be you don't want to be near electric or magnetic equipment, and then if your patient is obese, that can be a precaution. And then as the PT, I want to be 1 to 2 feet away from the pulsed diathermy that we're going to do, just as a precaution for me. So the first thing that we're going to do is assess her skin. So imagine there's a wound here. So since there isn't, so she's cleaned her skin, everything's good, it's all assessed. So on the machine, we're going to turn the machine on, and then we want to do the non-thermal diathermy. And then for it to be non-thermal, it has to be less than 38 watts on the machine. So you'd set that, and then you want to set a low pulse width and a low pulse rate. So we're going to imagine here. So I'm going to place this over her wound just for infection control. Oh, thank you. And then we're going to do the inductive coil diathermy, and I chose this one because her wound is deep, and so imagine this cord is the inductive coil. So her wound is deep, so the inductive coil is going to have effects deeper than the capacitor plates. So this is the treatment, and we made all the settings that I previously said, and then you would leave this for 30 minutes. You can leave it for 30 to 60, but this is her first treatment session, so we're just going to do 30 minutes, and I would come by every 5 minutes and make sure that everything's good. Any problems?
No.
Okay, and then at the end of the treatment, we will take it off and assess the skin, and it looks good. Have any problems?
No.
All right. So yeah, and you just have the patient just rest in a comfortable position depending on what part of the body you are doing this on. And then other treatments that can be used for this are the UVC, but there are mixed results with that.